Housing as a Social Determinant of Health is hosted by Delta Dental of Michigan. Please welcome the Manager of Strategic Partnerships for Delta Dental of Michigan, Ohio, and Indiana, Carmen Argersinger.
Good morning, everyone. I was going to start by congratulating you on all of your bright-eyed enthusiasm for showing up this early, but I think we'll go with coffee's in the back. Help yourself to as much as you need to be ready for Q&A later. So, jokes aside, though, we're here today to explore a truth that is increasingly impossible to ignore. Where and how people live has a profound impact on their health. Safe, stable, and affordable housing is not just a basic human need. It's a critical building block for overall well-being and a key driver for public health outcomes. As business leaders and policymakers here in Michigan, we know that the health of our communities is the foundation for a strong workforce, a resilient economy, and a thriving state. And few factors are more fundamental to community health than housing. Consider this. 61% of the homes built in Michigan were built before the use of lead-based paint was banned, which means that the majority of our housing units across the state are at high risk of exposing residents to lead and its negative health effects. The majority of our extremely low-income families are spending more than 50% of their income on housing. That means that they inevitably are diverting funds away from other important things like their health care. More than 33,000 Michiganders are literally homeless. This means that they're living in shelters or other places deemed not fit for human habitation. An additional 33,000 K-12 students and 10,000 children ages 3 and under do not have safe and stable housing. I don't want to glaze over that quickly. Those statistics are said that way in reports, and it makes sense, but what that means is that we have 10,000 babies and toddlers in our state that don't have safe homes. These statistics underscore the urgent need for collaborative action to ensure housing is accessible, safe, and equitable for all Michigan residents. Today's session will examine the intersection of housing and health through the lens of nonprofit, corporate, and government sectors. Our panelists will share how they're leveraging their strengths to create healthier communities, and they'll also discuss the barriers that still stand in the way of progress. To guide us through today's conversation and offer our government perspective, I'm honored to welcome to the stage our moderator, Amy Hovey, Executive Director and CEO of the Michigan State Housing Development Authority, whose leadership is helping shape housing policy across the state. Joining her on the panel representing the nonprofit sector is Kelli Dobner, Chief Advancement Officer for Samaritas, who works tirelessly to create opportunities for people and communities to thrive by delivering housing and social services to vulnerable populations throughout Michigan. Kelli? And from the corporate side, Laura Grannemann, Executive Director of the Rocket Community Fund and the Gilbert Family Foundation, who's been instrumental in Detroit-based initiatives that connect housing to the broader systems of health, education, and economic mobility. Laura? Amy, I'll let you take us from here.
Thank you. Well, we're gonna have some fun this morning.
Yes.
I love working with both of you. You know, we've had different types of partnerships, of course, all around housing, really, really, really smart women. And I think we're gonna, be able to share our knowledge, but also think together as a group. So we have cards on the tables. If you have questions, please be a part of the discussion. Blue cards, they'll be collecting probably in about 20 minutes. So you have some time to think about how to help frame our discussion this morning. And again, lots of coffee back there. Special thanks to you all getting up early after a long evening of receptions, but I think we're gonna do it.
I like that you said receptions.
Yeah.
I'm sure that's what everyone was doing.
So we had our bios read, but what I'd love to do is just ask you each to just talk a little bit more about what you do within your organizations.
Me first?
Yeah.
All right. Well, good morning, everyone. At Samaritas, we've been serving the state of Michigan for the last 91 years, coast to coast, about 38,000 people every year, and we do so in 4 significant areas: housing, child and family support, refugee resettlement, and behavioral health. And what we're seeing across the board is, housing is the underlying issue in all of those categories and well beyond. So it has quickly risen to the top of our list of something that we really need to pay attention to, be creative around in terms of how we get at this crisis, which I know we'll talk more about later. But we're really focused on an integrated care approach. So those 4 things are great, but if you don't take a comprehensive approach to address housing and behavioral health and even things that we're seeing in child and family support services, you're missing the boat on being able to holistically serve and get at those much more powerful outcomes.
Yeah, great. Laura.
Yes, hi everyone. My name is Laura Grannemann. I lead the Rocket Community Fund and Gilbert Family Foundation. We collectively have a $500 million commitment over 10 years. We're in year 4 to the city of Detroit and to building opportunity for Detroit residents. And the foundation of that commitment is housing, no pun intended. We say foundation all the time. But we, as one of the nation's largest mortgage lenders, we feel that we have both an opportunity and responsibility to invest back in systemic change in the housing space. And so the way that looks for us is a real focus on displacement prevention first. So trying to fight forces like property tax foreclosure and eviction for existing residents, and then building upon that to support things like housing quality. So a lot of home repair, a lot of housing supply, which we talked about earlier, our aging housing supply is in desperate need of continued investment, whether that's home repair or new supply. So we are always looking for innovative solutions, opportunities to partner with nonprofits like Samaritas and with government institutions. And so really excited to continue to develop that work. And obviously we build upon our foundation of housing stability work with additional investments in economic mobility, arts and culture, and public space. But we truly believe that housing is sort of the foundation of success for every component of our life. So we can't do anything without a place to lay our head and raise our children.
Ooh, I love that. I've been in this industry a long time, and I remember when I was in my 20s, I worked for an organization called the Local Initiative Support Corporation, which probably many of you in this room, if you're involved or interested in housing, have heard of that organization. And one of my least favorite parts about that job was fundraising, because it's just not my thing. But I remember really trying to make the connection at that time about how housing was tied to everything else. Because as you would approach funders, there are funders who care more about kids or health care. And I really tried to say, listen, housing is important to health care. It is. If you support kids, you support housing. Now, I don't know how good I was at that, making that connection, but what I like is that in today's society, people understand that, right? They really do understand the foundational aspects of making sure that people have a place to live every day so they can work on everything else. And at MSHA, we're doing a couple of things. We use some of our ARPA money to partner with the Department of Health and Human Services to create a program called Good Housing Equals Good Health. And it was really about educating our county health officials about housing, the supports that we have for housing, the programs that we have for housing, and giving them the skills they need to be helping people with housing navigation, right? Where do you go to get the added supports or find housing? So we're starting to do a little bit more of that cross-departmental work because we realize that, we need to work together to address this issue. What I want to ask both of you today is, how do you see health and housing intersect?
Yeah, they absolutely intersect. We believe housing is the key to community health. Like I said earlier, we think that housing is the underlying issue for so many things. You know, not only what we see in the populations that we serve at Samaritas, but as an issue and opportunity for our state. And so the great work that you're doing, you know, to help create that stock is really important. I'll talk about that in just a second, but because that is such an underlying issue, and we talked about that integrated approach to bringing all of this together, that housing it just creates the infrastructure well beyond brick and mortar, right, of what we're talking about with housing. So, you know, some of the populations that we serve, I'm going to take one example. You know, we serve people in behavioral health, so we help them get onto the road to recovery. Right, and we can put all of those supports in place and walk alongside, have that case management, and that's an ongoing process, right? But if that person is then living in their car, because that often happens because they can't afford housing right now, even if we can find them gainful employment, which, by the way, our system is not necessarily set up for that integrated approach. It is very siloed and it is bucketized in a lot of ways. And so if we can open that up through policy and funding and partnership to be able to cross-serve, that becomes a significant opportunity for us. And that example that I share is one of those. So you can have this road to recovery, you can be doing so well, but then if you are living in your car, even with gainful employment, are you gonna go back? You're gonna go right back to where you were, because that creates that stressor. And so if we're looking at housing as healthcare, that is just so significant in one small example, but I can apply it to several others. We see a lot of kids removed from their homes, enter the foster care system because of housing instability. So if we can stabilize housing, imagine the power that we have in creating a much healthier community across Michigan.
Yeah, no, I appreciate that. I know at MSHA, again, we work very closely with the Department of Health and Human Services to look at recovery housing. Yeah. We have a couple projects that we have funded where, you know, it provides a low-cost housing option and really builds the support to help people through the recovery process, where they're being held accountable by peers. There's a great project in Jackson, Andy's place. I don't know if you're familiar with it. If you haven't toured it, I suggest you do. It's great. Sonera helps support that. Thank you, Jennifer and Yolanda. And then also, we are working on setting aside some of our housing choice vouchers. And if you're not familiar with that program, it's often called Section 8, and it's rental assistance provided by the federal government to work with mothers who are at risk of losing their children due to housing instability. The problem is we don't have enough vouchers, right? It's interesting that in our country, housing is not a right. If you qualify for SNAP, you're gonna get SNAP, right? You're gonna get assistance with food. Everyone has a right to public education. If you qualify for Medicaid, you're gonna get it, at least for now. But if you qualify for housing and rental assistance, you're gonna wait in line, sometimes 10 years. So we just don't have, like, we all wanna do the right things, we don't have enough resources to do that. And we're gonna talk a little bit later about the risks that we are having right now and maybe even losing some of the resources we do have. But Laura, I wanna turn the question over to you.
Well, the question makes me think of that parable of the two fish in the water. Does anybody know what I'm talking about? No,
Keep going.
Like, what are you talking about? Okay, so these two fish, they're swimming in the water, and one turns to the other and says, because apparently in this parable, fish can speak English, well, gee, the water is great today. And the other one turns and says, what's water? Because, you know, housing for so many of us is just something that we go home to, and it exists, and maybe it kind of annoys us sometimes. At least once a year, my husband comes into my house and says, I'm gonna burn this place down, it's terrible. But obviously, it's incredibly important, and it's only when something's going wrong, or when you don't have that level of stability, that you truly understand the importance and the foundational nature of your home. And so every day, because I'm in this work, I try very hard not to take for granted that I have a stable home. I feel extremely lucky. And it's only at that point that you realize how many elements of your life and your safety and your health are connected to your home, whether that's asthma, whether that's air quality, whether that is the amount of sleep that you're getting every night. Like these things, they all add up, right? And then by the time you're 20, 30, 40, 50, 60, you start to feel these aggregated effects of the way that you've been living. And so anyway, I think these two things are inextricably linked, and we would be much better off as a society if we invested in proactively as though housing was truly a part of our healthcare system and was truly a part of our infrastructure.
Yeah. So we talk about, and Carmen talked about it, and you followed up with it about there's kind of two types of intersection between a healthy home and health, right? Physical, mental health. One is seriously a healthy home, one that's good environmentally, right? That's lead-free, that's rodent-free, that has good air quality. We also have talked a little bit about how just having a home contributes to both our physical and mental health. But Laura, I want to ask you, what role do you think philanthropy can play in kind of addressing it on both levels?
So I think that philanthropy has the benefit of having a long view of the future. A lot of our partners, whether they are nonprofit partners or whether they're political actors, they have sort of a timeline that might be dictated by a fundraising timeline, or it might be dictated by a political cycle. But philanthropy has the benefit of being able to look 10 years into the future, or 15, 20 years into the future, and saying, what are the long-term goals or visions that we have collectively, and how can we take small steps every day to get towards that long-term goal, regardless of the political cycle? Now, sometimes we obviously have to make adjustments to that based on what's really happening on the ground, but we can keep our eye on that long-term prize. And so I think philanthropy has an important role to play in continuing to push forward systems change, even when sometimes it's not popular or it's hard to fundraise for, or right? It's hard to build coalition around. But that's kind of our role, to keep that level of consistency and focus on our long-term vision. And so, I think a big part of our role is convening, is bringing people together in new and unique ways. A big part of our role is piloting projects. I'll give you a good example. We were able to work with NSO in the city of Detroit to launch a respite housing initiative. And we've obviously got some partners here in the audience as well. The respite housing, for anyone who's not familiar, is this idea that if you go to the ER or you go to the hospital and you have a procedure and you leave the hospital, you're maybe too sick to be on the streets, which, by the way, who isn't too sick to be on the streets? But you're too sick to be on the streets, but you're not sick enough to be able to continue to stay in the hospital. And respite housing provides you an option, a place to go, where you can more fully recover, where the hospital wouldn't cover that bill, but you can more fully recover in respite housing. This is a great example of something that is truly a part of our healthcare system. We need to allow people the space and time to heal before we're putting them back in the same environment where they where they got sick in the first place, right? So a great example of how housing truly is connected to our healthcare system, and we're truly appreciative of our partners for being a major component of that work.
I don't know about you guys, but I'm so glad I got up early this morning for this session, because I feel like, I've been doing this a long time, but I learned something new. I didn't know about respite housing. So that's awesome. It's really cool. Now I know about that, and I can imagine it's needed everywhere. And then also super refreshing to hear philanthropy talk about system change and patience. That has not always been the case with philanthropy, and I feel like I can say that because I was in philanthropy in my career. Is system change takes a long time, but it is the most effective way of addressing an issue, because usually an issue exists because the system is broken, but it takes 10, 20 years to change a system, and it needs consistent effort, consistent funding. I love that you see philanthropy in that role, and I encourage you to spread the word amongst other philanthropy, that don't get bored. It's not always about the pilot. Sometimes it's about that consistent churn of making changes that will last a lifetime or a generation. Okay, you're up. I want you to talk about, like, we've partnered together, and we know how important partnership and collaboration is to getting really meaningful things done. Talk to me a little bit about one of your favorite times or projects or programs where you've had collaboration and the success in that.
Oh, yeah, excuse me. Like I said, it's going to take that kind of collaboration. We're talking about systems change. We're talking about how funding is structured, right? And I'll say something here, right? We're living in maybe a bit of chaos, right now, right? We're trying to determine what to do next, how to manage in this environment, and right? So how do we take advantage of the time that we're in and create some clarity through that chaos? And sometimes that can be reinventing systems change, and maybe, or contributing to systems change, and maybe this helps accelerate some of that work. Not only keeping that eye to the future, but what can we do right now in that? And to me, that is creating systems where you have integrated care and partnerships, and you are holistically surrounding the individual with that kind of care, addressing the social determinants of health. And some of our most successful partnerships have addressed that very thing and taken that on. So we have 16 affordable living communities across the state of Michigan today, and we want to at least double that in the next 10 years. So when we're looking way out, 10 years is not fast enough, to get that done. So, when we have that kind of approach, we don't only want to provide the housing, which we partner very closely with MSHDA to be able to do, utilizing the LIHTC programming and so many of the other tools. And I know you can't bring enough tools online fast enough, right, to accommodate the need.
We're trying.
You are trying, absolutely. And I'm so glad that you're at the helm doing that, because you see that acceleration already under your leadership and your great team. But when we bring housing online, that's incredibly important. Like you said, I don't know if it was on stage or before, but laying your head down, right? And a place to feel safe and grow and thrive. And when you can provide that, that's great. How then do we take that a step further and work with our corporate community by way of example? When I think about this conference, who's here? We have a lot of corporate leaders. We have policymakers, public servants, government agencies. How can we all work together to be more intentional with that? So when we can lift up housing, by way of example, and workforce development opportunities, we see powerful outcomes like 86% sustainability and self-sufficiency and independence for our families within 240 days of care, right? When they first come into our care at Samaritas. Right? And how do we take that model and apply it to all populations that we serve? It should not be siloed. It cannot be, like I said earlier, bucketized. And so we partner with 300 corporate employers across the state today to bring employment opportunities that create gainful employment with our housing. And then we create that opportunity. And people should care about that because it's the well-being of your workforce. And when you have a healthy workforce, they're going to thrive. They're going to produce even more, right? And then they're going to go on to other housing stock options. And that's why it's important we create a spectrum from, homeless services and how do we get people out of that point in time of shelter all the way to home ownership, right? We have a homeless shelter right now that has 1,000 people, over 1,000 people on our waiting list. Right, so it's as one example. So when we create those opportunities, lift up those two social determinants in particular, we see wonderful, quite powerful things happening.
Yeah, so really interesting. I always want to educate people in case they aren't familiar with our homeless ecosystem in our state. But we have people who live in homeless shelters for years, and these are working people. These are people who have jobs that come with benefits, but the jobs just don't pay enough for folks to be able to afford housing. I mean, that's when our system is broken. These aren't folks that are in that aren't working because of whatever reason. These are people that are putting in their time. They're contributing positively to society, and yet we aren't taking care of them in a way that we should. And then also I want to just point out the importance of that corporate partnership. We at MSHDA just started a new program that hopefully you're tapping into, maybe not, called the Employer Assisted Housing Fund, which provides a dollar for dollar match for any corporate investment into housing. And it's really flexible. It can be any type of, it can be subsidy for the development of housing, for down payment assistance, for rental assistance, really just trying to leverage additional dollars into the housing shortage in our state today. So if you're not tapping in,
Yes.
Laura, I know you're doing tons of partnerships, so give us a flavor of some of your favorites.
Yeah, well, maybe I just want to riff off of something you said, Kelly, which is I think this is a crazy time. There's a lot of change happening. And I keep coming back to this idea that housing should be bipartisan. We have across the country, depends on who you talk to, but Realtor.com put out a study that said we have a 3.8 million housing unit shortage across the United States. 3.8 million, that's a huge number. And Michigan is no different. We have huge housing shortage. Amy,
119,000 units short today.
119,000, thank you, Amy. And Amy, the other day at the housing panel on Tuesday, mentioned a few factors of why that was the case. We have an aging population, so there's fewer people that are living in single family homes. We have more people who are leaving their home and looking for a house. We have aging housing stock, and so that is creating challenges, as well as a lot of our communities have been experiencing blight, which is sort of related, right? And then we tear down the home. So again, we're seeing this sort of churn of our homes. So it should be a bipartisan issue. We should be investing in it collectively. And yet, we often wait until the very last minute to be trying to help people. Thanks, Darnell. Until the very last minute, right? We wait until the emergency is so dire that there needs to be intervention, and by that point, a lot of times it is too late. We have either someone has lost their health as a result, and that's really affecting the success of the rest of their life, or the intervention is just expensive, right? So whether you're looking at it from a social perspective, you want to just help people and make sure that they are set up for success, or you're looking at it from an economic perspective, it does not matter. Making that investment ahead of time is always going to be a better solution. And I'll give you a very specific example. For a very long time, we have been invested in the city of Detroit in preventing property tax foreclosure. This is a huge issue. How many people are from Detroit in this room? Okay, so a few. So this is a huge issue that's been really detrimental to our neighborhoods for 15, 20 years. Folks will get behind on their property taxes. They will, 3 years after they get behind, they ultimately lose their home to tax foreclosure. A lot of times, many of us are paying our property taxes through our mortgage, but these are folks who own their homes outright, and so they don't have to pay their property taxes through their mortgage, they're just paying them directly to the city. The city then sells their tax debt to the county then forecloses on their home after 3 years. Well, this has caused a huge amount of lost wealth in our community, especially in our Black community in the city of Detroit. And a lot of times we were seeing folks who were losing their homes for an average of less than $5,000. The interventions that we're talking about from a homelessness perspective, shelter housing, interventions to try to get people into rental housing, HUD vouchers, those are insanely more expensive than a $5,000 payment. If we had just made those $5,000 payments early on and helped people get back on track with those payments, we as a society would not only be stronger because we would have less blight in our communities, we would be more economically resilient because we would have more people who were contributing to our community. There's so many benefits to making that $5,000 investment early on in the process, but too often we waited and we lost population, we created homelessness, we created instability as a result. So the Rocket Community Fund in this case, because that was the entity that made this investment, really we started going door to door and talking to people who were at risk of foreclosure and helping them get connected to a property tax exemption that exists in the city of Detroit. And then actually the Gilbert Family Foundation, one of our very first investment as part of that $500 million investment, made a $20 million commitment to paying off the back tax debt of anyone who could qualify for this low income tax exemption. So far we've been able to help over 10,000 people stay in their homes as a result. Thank you. Which is truly amazing, but I am always sad when I think of the fact that over 150,000 families lost their home to foreclosure before we were able to make that investment.
It's a great program. I still have more planned questions, but these are good questions. You guys are doing your work this morning. So we're gonna take some of the audience's questions. I don't think we can avoid this question, and I'd love to hear what your answers are. As we look at potential cuts to HUD and Medicaid, how will each of you respond to these changes and how they impact housing?
You go first and set the tone.
I'll answer too, to be fair.
Do you want to start, Amy?
You want me to start? I'll start. Because I've been thinking about this for a minute. MSHDA is almost 100% funded by the federal government. Oh, we have some concerns with what that skinny budget looked like because it basically took our entire budget. But we're confident. I gotta tell you, we're plowing straight ahead. We're spending funds as quickly as we possibly can spend them because we know the need is great out there. We are assuming we're going to continue to get funds from the federal government, and we're going to continue with all of our programming. Now, is that pie in the sky? Maybe, but we have to. I am confident in our country's dedication to our population that we will continue to invest in housing. It may look a little bit different and there might be some cuts, but we're gonna be there, we're gonna figure it out, we're smart people. We're gonna have to work harder together and maybe smarter, and that's some opportunity that's gonna come out of this time. Sometimes we're doing the things that we've done for the last 20 or 30 years. And this is like really gonna make us take a step back and go, okay, well, we have to be better at what we do. We need to reduce the barriers. We need to streamline processes. We've got to be able to do this in a more economical way. And we will do that. We will continue to build housing. We're going to continue to fix housing. We're going to continue to operate the Housing Choice Voucher Program. If it's cut, we're going to work with all of you to figure out how do we help those people that will no longer get rental assistance. And like you said, maybe we're going to work hard at preventing people from needing those vouchers in the first place. We need to continue to view this time, as stressful as it is, as an opportunity. And I think we're up to the task.
Yeah, I agree. I think it is an opportunity, right? I think if we do start thinking and prioritizing housing as healthcare and realizing that if we're in a housing crisis now, and if we extend that to understand the depth of how housing impacts the health of an individual, a family, a community, business, an entire state, then that does create that opportunity to understand the depth of the crisis and how we all have to play a role in changing that, right? So if we are losing funding federally, how do we then group together and engage the philanthropy community, the private sector, to build new funding models, because all of us are going to benefit from that, like you were talking about, whether it's the human condition factor that you care about or it's the economic impact. We all have a stake in this, and so we all must work together to be able to respond.
That's right. Now, there's gonna be a ton of pressure because every industry will probably see some cuts, and everybody's gonna wanna run to either the state budget or philanthropy, and we know that the state budget isn't gonna be able to handle it, and quite honestly, we know philanthropy can't handle it either. So What are you guys going to do? It's going to be tough.
Yeah, well, listen, I think that it is important to acknowledge that this is not good. I don't mean to totally disagree, but I do think it's an opportunity. I do think it's an opportunity, and I think we should view it that way because we have to. You know, necessity is the mother of invention. We have to work together differently, and there will be good things that will come out of it. But I think it's important to say that there's some decisions that are being made that will undermine the infrastructure of what we have built in Detroit and beyond. And that is scary. And we should be really well aware of what those changes are and what the impacts are going to be. One thing that immediately comes to mind, I see my wonderful colleague Darnell Adams. He's worked really hard with a network of community development organizations to support these local grassroots nonprofits that are meant to be neighborhood-based and set up for success to help people in their neighborhoods get access to housing, be more stably housed, be more well-housed, if you will, as our friend Jeremy Potter likes to say. But that type of network approach, where we've invested a lot of money collectively and a lot of time and a lot of effort into building the capacity for those organizations to support their neighbors, there is a big risk that a lot of that goes away. And we end up with a much more reactive system where all of the progress that I just talked about around trying to get ahead of the problem becomes, I can't talk to 10,000 people ahead of time. I can only deal with the people that are downstream, and therefore we're intervening too late in the game. So I think it is important to say it's not going to be good, and we should fight for more investment. We should fight for the fact that this is a bipartisan issue, and we should frame that conversation as, yes, there are social benefits, there's huge economic benefits, and we need to continue to think creatively, but at the same time advocate for thinking about this as a system approach that needs significant investment.
Yeah, I think that's a great answer. I think as we are looking at opportunities, and we have come up with some new programs at MSHDA. In one, we celebrated with a press conference yesterday, housing tax increment financing. And I'm not going to dig into that product, but what I like about it is it with a tax credit, it doesn't need appropriation. So it doesn't keep coming back up for folks to say, I like it, and I don't have to convince a whole bunch of new legislators to keep doing it. It's just going to keep going, right? Like, that tool is not going away, and it's super flexible. So it, up to 120% of AMI, and I know there's advocates to even get that up a little bit higher, but also it can be used for rental or home ownership or rehabilitation, new construction. But as we look for solutions, getting solutions like that are lasting is crucial. For us as well, one of the positives in this big bill is, the increase of the low-income housing tax credit, right? There's a 12.5% increase in there, a few other adjustments to that program to make it a better program. We're gonna have to probably boost that up a little bit to make up for some of the things that we might not be able to do, and take the opportunity to change things a little bit more. I wanna dive back into one of these questions because I think it's interesting across the board on really connecting people to programs and services. And the question verbatim reads, what role does shame play in the challenge to get unhoused people help? And I want to push this to you both, but I'm going to broaden it. So whoever wrote this, I hopefully forgive me for taking some liberty in broadening that question. But not just in getting the unhoused people help, but people in general to come and say, yeah, I'm late on my taxes, I need help, or I need a new roof, or certainly, Kelli, with the populations that you serve, there is probably some shame or pride issues. How do you guys address that so that people will get the help they need?
That's a big question.
I know. And I made it bigger, but I thought it would make it a little easier for you to answer.
Yeah. I mean, we're very person-centric, right? You know, where we meet people where they're at. It's never a point of, I'll call it judgment, right? You know, or whatnot. We meet people where they're at. We must have that. We must have empathy for where you're at and walk alongside and create opportunities for empowerment. I had somebody talk to me at one point. He said, you know, the way you frame it, you need to consider how that's being received, right? And to get at that very concept of the shame or whatnot that comes with being in a vulnerable situation. And it's not, you don't empower somebody. You create opportunities for them to be empowered and pave that road for them in any way that you have power to do so, right? And make that available. And so that's really where we're focused on that. I think our industry, I think most people that we do work with take on that same approach and paint that picture for what's possible and help people with resourcing to be able to get there.
I think from a philanthropy perspective, this is why it's so important to invest in local neighborhood organizations, because they're the ones who are living, you know, they are neighbors of the people who, they will know the people who they're trying to serve, right? And so I mentioned before the door-to-door outreach that we do, that's a great example of, we actually hire individuals from the neighborhood to knock on their neighbors' doors, and that breaks down that sort of shame a little bit in order to at least start the conversation with a slightly more, on slightly more solid footing. Yeah. I will also say, I think it depends very much on the situation. Because when we rolled out a home repair fund, and we, within the first week, got 250,000 phone calls. But then
they weren't shy.
No, they were not shy. They were not shy. I think it depends on how people view the circumstance that they're in. In some cases, they view it as a personal fault or a personal deficiency. So with tax foreclosures, a great example, that feels shameful because I didn't pay my property taxes. I can't keep up with my responsibilities. When in reality, we all know that it's a systemic problem. You don't get 150,000 tax foreclosures if it's just a personal responsibility issue. It is a huge systems problem. But it feels like you carry the shame of that particular issue. Versus home repair, where you can look around your neighborhood and you can physically see everybody's struggling with this issue, and I just don't have the resources, but also my home is not valued enough to be able to get the financing I need. So it feels more like a ubiquitous systems issue that no longer feels quite as shameful. So I think people were more willing to reach out in that particular circumstance. Yeah.
So we talked about advocacy, right? And with your nonprofit add-on, we don't talk advocacy as much as education.
Yes.
Right? Educating people.
That's right.
You know, we really need to pay attention to metrics because they tell a story. Why the individuals tell a story to get to people's hearts. We also know that some people are better approached through their brains. And can you tell me a little bit about how you track metrics and tell that story?
Yeah, we definitely have to apply to both heart and head, right? To depending who you're talking to, and creating that opportunity for advocacy and education. And a lot of times the economic piece, that argument in particular does fall short. So when you said that earlier, that really resonated with me. The thing that we track, or multiple things that we track and present, is that economic impact that you have when you invest in people, and that is the language that we use. It is an investment upstream. I'm glad you mentioned that as well, because it always costs more later, right? Always, just hands down. So we measure things like self-sufficiency, how long that you're in a home, how long does it take you to achieve home ownership? Not everyone wants home ownership, but a lot of people do. So creating that opportunity for people to move from a rental situation to a home ownership, and how long does that take? How long that they're employed? What does that promotion path look like? That career pathing? How is this is a little bit trickier because you have privacy issues, but their overall health. Some people want to know, some people want to share, right? Like what does that look like, especially people that are in our recovery programs? What did that path look like, and what is that time frame? And I think that that's really important to understand how much you're investing in order to achieve that at different points in time, and what is that end result? And they're really powerful.
Yeah, is it hard to collect that information?
Yes.
I can
Very
imagine
hard.
people not wanting
I didn't mean to answer that so quickly. But yes, I mean, with the individuals, the ability to share on that trust issue and face-to-face, but we also have systems that do not support data sharing, right, at all, right? They go into a big depository and somebody else has access to it, and the people on the ground floor that are doing this work don't. And if you want that access, you have to duplicate the effort to be able to track it, to use it, track it, understand it, so that you are doing something useful with it and changing course of action if you need to along the way as a result.
Yeah.
So no, it's a huge issue.
This is so true. We have been investing in this sort of like, we call it a universal intake process. So the idea is anyone, no matter what they're trying to accomplish from a housing perspective, they're going through one portal, and then that is a network of folks who's servicing them depending on their need. And then that data is all supposed to go into one place. But my goodness, we've been working on this for 4 years, and we're making progress, but the steps to get there have been arduous. And so it is not for the faint of heart trying to do this data collection. And I think a lot of people give up along the way.
Yes.
I gotta tell you, it's gonna amaze you that the state isn't really good at data sharing. I mean, even amongst departments, right? Because as we talk about us working together, there's information, of course, that the other departments have that would be helpful to us, and data that we have that would be important to them. And to do a data sharing agreement takes a lot of work, even within the same entity. It's crazy.
Yeah. Well, and then the investment in that, and the investment in the people power to actually do something with that data once you come to an agreement and how to share it, is a whole nother.
I feel like we could go on about this
We could.
over a cocktail or something. Okay, we got time for a couple more questions. Let's get to it. So another question from the audience is there any innovation or anything novel to bring down housing construction costs?
Who asked this question? Darnell, was it you? I feel like it might have been you. Okay.
I feel like this was an opportunity to say something they wanted to say.
Yeah, this feels like a layup. Yes, there is. I think that, so the average construction timeline is like 18 months, which if we're facing a 3.8 million unit housing shortage, it's going to, at the pace that we're moving today, take about 7 years with that construction timeline to be able to achieve that gap, even if nothing else changes. So if we're not losing any other housing stock, it takes 7 years to make up for that gap. That's too long for a lot of the people that we are talking about today. And so we have to start investing in new technology. And again, I think this is a place where it's a bipartisan issue, and actually this is a great place for the public sector to continue to invest and increase their investment. It's a great place for policymakers to be thinking about how to incentivize these types of new products, because there is burgeoning technology with 3D printed homes, with manufactured and factory built homes, modular, but it's not quite there yet. It's not there enough because we don't quite have the scale that we need to bring those resources to our everyday consumer. And so right now it's happening in pockets. But with some legislation or with some investment from both the private and public sector, we could really accelerate that timeline, that 7-year timeline.
Yeah.
And I also want to call out, again, my wonderful colleague, Darnell Adams, has been working extremely hard on a showcase that exists in the North Corktown neighborhood in Detroit. It is a factory-built housing showcase that shows just how beautiful these homes can be. So if anyone hears the word manufactured and thinks it's a trailer park, That is not true. This technology is gorgeous. I would be proud to live in any one of these homes. And they are both high quality, beautiful, and climate resilient. So I think that there's a lot of benefits that really, it's not just for a lower income population, it's for all of us. And we should really think about how to integrate these technologies into our day-to-day.
I mean, I'm sure you have learned some of it is actually higher quality than stick built, right? And so they're actually getting better than what folks would imagine. And the resilient housing is something that we certainly have not caught up in our state. Other states down south have invested a lot more in it. But, you know, over this last, I guess, even 2 weeks down in the Lansing area, we need to really, you know, step up our game, right? We're having windstorms. We're having tornadoes. We're going to continue to have rain events that cause flooding. But yet our housing stock and even the new technologies that we're using in Michigan today aren't looking at that. And I feel like we're being reactive already, and we shouldn't be. Okay, 2 minutes, enough of me. Okay, I'm gonna let you go wherever you want with this. I'm gonna give you 3 things, you answer whichever one you want, okay? 1, you can talk about a barrier that we need to eliminate. You can talk about an opportunity that we should be doing that we haven't done yet. Just those 2, that's enough. Who wants to go first? You each get about a minute to answer.
Wow.
Or less.
That is a lot of time. Good. I'm going to take the barrier, right? You know, I think one of the things that we fight when we talk about housing and lifting that up as, you know, as healthcare, right, is NIMBYism, right? You know, not in my backyard. I'm glad that you lifted up the manufactured housing. I think that is such a huge opportunity. I wish I had an extra minute to talk about that because I'm so about that. It creates a whole nother workforce too, right? Another industry here that we can easily fuel. But I'm in barrier. I answered the barrier question. But you know, addressing some of that in NIMBY, I should say, not in my backyard, right? Is what that means in terms of affordable housing. I am in my pursuit of educating and advocating for this, am regularly up against if we create affordable housing, then that concentrates poverty and it creates pockets of crime, right? That foster crime, and it's just not good, right? You know, that's what people think, and then
Not true.
It's not true, and you can show them all the data, right? And that's what we must do. We have to continue to advocate. We must fight, you know, that, and we fight a lot of things, right? We have to use our voices, these kind of forums beyond this island, and go forth, right? And fight for this funding, fight for perceptions that we need to change. And this is one of them. It doesn't do either one of those things. It only invests in people and communities and creates stronger families, stronger communities, stronger workforces when we can combat not in my backyard. We want it in everybody's backyard.
Right.
I mean, I think the best opportunity that we have is to think creatively about housing stock moving forward. I often say that, like, we can't build on a foundation of quicksand. So if we're constantly losing our housing stock, it's going to be very difficult to fight our way out of that. I talked before about home repair. We think in Detroit, just Detroit alone, that's somewhere around a $5 to $20 billion issue. Like, we're not going to fund our way out of that tomorrow. So we have to start thinking differently about these home housing construction technologies, new housing production, while we are also helping people get access to resources to improve their own existing homes.
Yeah. Thank you. You guys are wonderful. And thank you all for getting up. Hopefully you've enjoyed this conversation as much as I have. So thanks.
Thanks to Delta Dental.
Yes,
Thank you to Delta Dental. Hey, great job. That was
Distinguished guests, please make your way to the theater for the next session.